I'll come to the last talk and we'll discuss it after that. This is a question we faces now. Actually, do we have enough space for all private hospitals in Kerala? So the number of private hospitals are increasing day by day, and this is a question. I personally believe that yes, we have enough space at present. The second question is whether there is a healthy relationship between doctors, between these hospitals and doctors. So sometimes it's not that healthy. That is what I few years. Whether there is a breach of ethics in this tough competition. I think we have to keep ethics also to some extent. There is no need to break the ethics. So coming to the first question, whether we have enough patients for all these private hospitals. This is a National Blindness and Visual Impairment Survey conducted in 2015-19. So it was conducted all over India, and Trichy district in Kerala was a part of it. And they defined blindness below 3/60, like all other things. I am not going into the details about the thing, but they have found that 618, and that is point they find out is a visual impairment of that thing. So blindness was 1.99%, and the visual impairment was 13.76 above the age of 50 years. So among that thing, cataract was definitely the highest number of blindness. So we extrapolate this number into the population in 2017, actually 8 years back population. Actually, below 50 years, it was 111 crores plus, and above 50 years, it was 21 crores only. So when you find it, visual impairment is 3 lakhs, 34 lakhs. But in the Kerala situation, I am just telling about the all India situation. It is totally different in Kerala. Not totally different, but it is different. What is the vision at which we advise surgeries? This statistics and all is telling about a 618. Definitely we know that in Kerala now 618 is not the vision. So it is much below that thing, because patients are educated, they want to read, and also the competition also and the practice also is putting some pressure on the reduction in the operating vision less than 618. So it is not the 13.76 below 618, that is all India this thing, that is also above 50 years. In the last WHO calculation published, they says 1/5 of our population are senior citizens, that is above the age of 60 years. That is the main difference between all India position and the Kerala position. Here the older population is much more compared to an all India situation. Life expectancy in males are 78 and females are 82. So Kerala, if you take 1/5 of the population, around 70 lakhs plus are there. So 612, if you bring down to 612, it will be around 25% of that. That is if you consider one eye alone. So 25% of 70 lakhs is around 17.5 lakhs. What I am trying to convince is some around 17.5 lakhs patients are there for operation now. So this is information I got it from the government that last 23-24, it was 2,51,000 surgeries are conducted in Kerala. So that means we have enough cataract to operate it. That is based on around 612 vision, not based on 6/6 partial or 6/6 vision. Then it will be much more than that. So we have enough patients. But if the more and more hospital comes, then it will be a little more tighter. But now there is a chance. Definitely what we are discussing is how to enhance the practice in private doctors and private eye hospitals. As Thomas Arian mentioned, the charitable hospital as well as in private hospital, most of the time we have non-ophthalmic managers. So they will advise you only in two ways. One main thing is really advertisement. And second thing is sometimes they will tell you about a fee sharing. That is a good word I use. If they are telling these two words only, then it is very clear that they don't have any idea, because this any fool can tell you. But when you look at the hospitals having the maximum number of patients, these type of hospitals, they are not giving any advertisement, they are not giving any fees to the referring doctors. So what it proves is, it is not the way by which you get the patients. So it's a clear cut. When you look at the population, look at Kerala, you should see that which hospital is getting maximum patients and what is the way at which they are getting the patient. That is a simple technique. So the second, the commonest technique in Kerala is conducting camps. That is a way of indirect advertisement. This for the charitable hospital as well as the private hospital, everywhere it is conducted. I think other than Dr. Sanitha, everyone is doing it. Most widely used and a time-tested technique, because even outside the states hospital also is conducting. And charitable hospital also shifting from total free to concession and selected free. That is good. Private hospital also gives discount and sometimes to a full rates also. Some of the camps are totally screening process only. And there are other ways by which you can enhance your practice. That is what is happening is World Sight Day, Glaucoma Week Day, everything. That actually increases your practice as well as others' practice. When you give a glaucoma awareness classes to everyone, more and more patients will be going to the hospitals, doctors, not only to you, other people also. And there are newspapers also. Their interest is different. They won't have any, whatever they tells, they are only interested in money. This is another way, because it's not the usual thing. This is what I am telling you is about what we have followed it at some places. We always concentrate on ophthalmology. Don't think that only concentrating in ophthalmology is the method of enhancing your practice. You do it in other way also. That you will convince the population that you are not for only money and you get patients. So this is some of the things we conducted. Actually, this enhanced our practice. Actually, with the enhancing, that was not our purpose, but indirectly we got a benefit out of it. So, how we increase this thing? Very simple thing. It is all depends upon a demand creation. The only thing is, sometime accidentally, we create the patients on demand. So they will be demanding. Some of the advertisement, some of the methods what we adopted finally works against you. So this should be such a way that patient should come to you. So don't go to the patient very forcibly, that indirectly will work on other way. So sometimes you will be giving coupons and all that. They will demand more and more. Sometimes you get all of a sudden you get some patients, but on a long run, it is not that. Mouth to mouth is actually an excellent way. How we will make it on our demanding side? Make sure that you have the best equipments. You look at the good hospitals what I am telling good hospital is, number of patients are more. You see that they will have good equipments, best facilities, and indirectly show you a result. And most of the people, what they are doing is they will put a testimonials in the website. And most of the people in social media, they are aware how the testimonials are going on. So don't think all the patients are fools. So show your hospital in a good way, not only in ophthalmic, education, everything you can do it. Showcase your services. You can showcase not only in a direct way, you can showcase it everything in an indirect way, and the patient will accept it. Whenever you are going that I can do this thing, I am the best, I am this thing, they won't someday accept it. If there are some persons, some other groups explaining about you, then it will work very well. And reduce the delay in your hospitals, because nowadays patients all wanted fast service. But you know that it's all the delays, we cannot reduce it, because some of the cases you have to dilate and you have to test it. But the important thing is you have to tell the person or patient why that delay is there. Do not tell any bad comments about the others, your colleagues. Simplest policy is affordable rate and quality services. The rest of the thing will happen. Advertisement usually bring some patients initially, but some of the patients, the advertisement will make unhappy also. So always look around for the good examples, learn from the established persons and hospital, look which hospital having high patient, that is what I was explaining all this time. Observe their techniques, observe area actively promoting hospitals and not having patients. You can learn the negative things from them. You will learn what you should not do from them. Never listen to high profile business persons who have never run even a small tea shop. So they will take classes. You have to be careful. Take advice and help from the right person. So some of the people will be helping you in all these days. So you take advice from them. So